This is the kid that just won't speak. Okay. Older children may appear oppositional and exhibit school refusal. So they don't even want to put themselves in that situation, so they're going to get all up in your grill and not want to go to school. Symptoms may be exacerbated by environmental factors such as a new school or the family moved or something along those lines. All right, so how do we diagnose this specifically? Multidimensional anxiety scale for children, known as the MASC broad anxiety scale for ages 8 to 18. The students or the patients self-report on this. At 8 years old, they're old enough to self-report on that. Social phobia and anxiety inventory for children, ages 8 to 17, they self-report. There's also another, the Leibowitz Social Anxiety Scale for Children and Adolescents is clinician administered, so you do that with the child. All right, so how do we treat this social anxiety disorder? There's cognitive behavioral therapy, group therapy, family therapy, also SSRIs. You're just going to start this very low, okay, so you're just going to do half the recommended starting dose for a longer time than before you step it up, because usually they just need that little bit. All right, disruptive behavior disorders. Oppositional defiant disorder, this is ODD. This is characterized by a pattern of they're not a very positive person at all. A lot of times they're hostile, and a lot of times they're just openly defiant and in your face. ADHD and ODD or CD have been found to co-occur in 30 to 50% of cases in both epidemiological and clinical samples. Conduct disorder, more severe than ODD. ODD, it's kind of a new one. It's kind of a new DSM-5. But the more severe one is conduct disorder. Okay, habitual rule breaking defined by a pattern of aggression, destruction, lying, stealing, and truancy. While conduct disorder is a strong predictor of substance abuse, ODD without conduct disorder is not. Okay, everybody see the distinction there? Can anybody guess why? In my opinion, ODD is sometimes a transitional phase of adolescence, although not a very welcome one, and certainly not one that has to be expected in every child. So they're going to outgrow that. Conduct disorder, more severe, more persistent, and they're going to try to self-medicate because they recognize that there's something wrong with their attitude about the rest of the world. Does that make sense, guys? All right. 4 main categories of conduct disorder: aggression towards people and animals, destruction of property without aggression towards people or animals, deceitfulness, lying, and theft, and serious violation of rules. These are the kids. This is the 12-year-old that won't come home at night. Okay? All right, conduct disorder 3 from 1 or more of the 4 categories in the past 12 months, with 1 in the past 6 months. Okay? So this is a continual repetitive thing is what that means. Aggression to people and animals includes things like they're the bully, they threaten, they intimidate others, they start fist fights, they start fights at school, they use a weapon that can cause serious physical harm to others like a bat, broken bottle, even a knife or a gun. Physically cruel to people, physically cruel to animals. Okay, and that can start sometimes pretty young. Stolen while confronting a victim, like they've mugged, purse snatching, extortion, armed robbery, forced someone into sexual activity. Yeah. All right, destruction of property, deliberately engaged in fire setting with the intention of causing serious damage, or deliberately destroyed other people's property by another means other than fire setting. So these are the kids out at 2 o'clock in the morning throwing beer bottles through windows. Okay? Deceitfulness or theft, broken into someone else's house, building or car, whether or not they gained from that, profitable or not, they just broke in to break in. Often lies to obtain goods or favors to avoid obligations. Okay, they're common people. Stolen items of non-trivial value without confronting a victim, like shoplifting, but without breaking and entering, forgery, that kind of stuff. Serious violations of rules, these are examples of some of that. Stays out at night despite parental prohibitions, beginning before the age of 13. Has run away from home overnight at least twice while living in the parents or some kind of surrogate for the parents. Because a lot of times, by the time the kids get to this age, the parents have, you know, can you take Johnny for the summer because I need a break, you know, to their mean older sister, you know, that they think can keep them in line. So that would be a parental surrogate. Or they just ran away once but was gone 2 weeks, okay? Often truant from school beginning before the age of 13. And truant means they get up, they act like they're going to school, and they turn left somewhere. Okay, this is not, Mom, don't make me go to school today, please let me stay home. That's not this. Truant implies that the parent thinks they're at school, but they're not, okay? All right. Cognitive behavioral therapy can sometimes help with this. Family therapy, parenting, education, meds, you know, there's the problem with the meds that treat this is there's significant side effects and there's significant potential for abuse. Anytime you think about a medicine for a teenager, you got to think about a potential abuse potential. This is something the kid can sell, you know, if they're so inclined. This is something the kid can save up and then take 3 and get some type of a high from it, okay? If you are treating well, you won't be prescribing, but if you're working with somebody that is treating kids for ADHD, you need to occasionally drug test that kid when they come in your office. Make sure they're actually taking their medicine and not just selling it to finance their car they're saving up for at 16. And it's a real thing. It happens more than you might imagine, sadly so. All right, let's move on to the next uplifting topic. Any questions so far about the angry kids? Yes?
I have a quick question, just about approaching a child in DHS custody.
Mm-hmm.
I mean, that's a stressful situation in and of itself.
Yes.
Do you think kids are overdiagnosed in those situations? Because it's like, you have to be so careful, that fine line.
You do, yeah, and you gotta remember too, in a situation like that, if they've got social services involved, you throw a diagnosis on this kid, it's gonna follow them the rest of their life. It might keep them, I mean, a lot of kids in that situation will turn to the military they don't have, you know, do you know what I mean? They turn to the military for that guidance and that purpose. And that structure and that purpose in life. You throw some of these diagnoses at this kid, you can totally eliminate that option for their future. So you gotta think long and hard before you actually do something like that. But you're right, a lot of times these kids are just reacting to the situation and they're not really diagnosable. So that's where getting to know the kid helps. If you're in a pediatric clinic situation and you take, so I worked with one physician that didn't take Sooner Care, but took straight Medicare. So this provider saw kids in the foster care system, but not Sooner Care. So, I mean, you know, you just gotta know your patient, you gotta know your foster parents. In that situation, the kids might change, the parents were the consistent ones. Does that make sense? Okay. Any other questions? All right. Suicide. Suicide is the third leading cause of death for adolescents and emerging young adults, 10 to 26. That is staggering to me, whereas it's the 10th overall cause of death for Americans. Adolescent mortality from suicide tripled between the 50s and the 90s and has remained overall stable since then, after declining somewhat in the 90s and then rising again in the past decade. Females attempt suicide at a rate of nearly 4 times that of males and are most likely to attempt suicide through ingestion. Males 15 to 24 years old are 5 times more likely to die by suicide as females and are most likely to use more lethal methods. In other words, once a male decides to do it, he'll make sure the job gets done. Completed suicide rates are highest in non-Hispanic, white, 13, almost 14 out of 100,000, and Native American, almost 11 out of 100,000. Suicide rates for black males 10 to 19 years old doubled between the years of 1980 and 1995. Gay, lesbian, bisexual, transgender, and questioning youth report significantly higher rates of suicide thoughts and attempts than their heterosexual peers. More than half of all deaths by suicide in the United States involve a firearm. All right. Annually in the United States, approximately 2,000 adolescents die from suicide and over 1 million suicide attempts come to medical attention. There's probably 11 times more than that just attempt. There are 11 times more attempts than completed suicides. And a ton of them don't even come to any kind of medical attention. That's where you're gonna pick them up in the office after the event has occurred, okay? Overall suicide accounted for nearly 11 deaths per 100,000 people, ages 15 to 24 in 2001. In 2013, 17% of youth surveyed in grades 9 through 12, 17% of youth surveyed in grades 9 through 12 reported seriously considering suicide at home in some point in the preceding year. And 8% of them had attempted it. That's 2 out of 10. That's nearly 1 out of 5 kids that walks into your practice in high school has thought about suicide in the last year. And, 1 out of 10 has tried it. Risk factors. Well, previous suicide attempts, obviously a risk factor for another suicide attempt. Social isolation, substance or alcohol abuse, these kids are self-medicating. Family history of suicide. Family history of severe mental illness or substance abuse. Past or present sexual or physical abuse, family conflict or disruption, or the presence of firearms in the home. We, at one place that I worked, every well child check had a questionnaire that went with it, and one of the questions was, do you have firearms in your home, and do you have some type of a trigger lock? And I never really thought about that until I had this one guy that refused to answer my question because he felt like it was an invasion of privacy. And then you just gotta educate these parents. We don't care. We're not compiling these statistics. We're not doing anything with this information other than trying to keep your 3-year-old from accidentally finding your gun and shooting themselves or their sibling, or trying to keep your 15-year-old that just got dumped by his girlfriend from using that gun for the very last time in an impulse that he might not have had 12 hours from then. That's all it is. Kids are you get them through 12 hours and you can change their life. Examine skin for signs of physical abuse or self-mutilation, including extremities and the torso. You guys all know, I've heard of cutting, right? Okay. Be sure and check the tops of their thighs when you do their physical exam. You've got them gowned, the females are in their bra and their underwear, males are in their underwear, they're gowned. Check. When you do that scoliosis check, that's a perfect time. That's a place that they can hide cutting. Most of the time it's on their arms. You get them in a gown, the gowns are short sleeve. They refuse to take off their shirt underneath their gown. That might be what they're trying to hide. They come in July wearing long sleeves. They might be trying to hide something. 20 to 50% of those attempting suicide will try it again. Multiple reports show that a majority of adolescents and young adults who attempt suicide disengage with treatment after a few visits due to a multitude of systemic and societal factors. Sometimes they don't think they're worthy. They don't think they're worthy of all that caring that adult is putting into them. All right, any questions about suicide or suicide attempts? All right, I think Tricia mentioned, was it Tricia that mentioned Munchausen by proxy the other day? Okay, moving on. Symptoms of illness in a child that are exaggerated, fabricated, or induced by a caretaker. There's usually no underlying health disorder in the child. This is like really sick stuff. The parent is seeking attention through the medical attention of their child. It results in harm to the child victim through repeated interactions with the medical care system, including unnecessary tests, medications, and surgeries. So they're faking an illness in their kid. The kid has to have lab drawn, known by many names, including the following: pediatric condition falsification, caregiver fabricated illness, medical child abuse. I like that one because that really just nails it right there. It is medical child abuse. Factitious disorder by proxy. All refer to harm that befalls children through the actions of a caregiver in a medical situation, a medical setting. Symptoms decrease when the child is separated from the perpetrator. Okay, you guys are too young to remember this, but when I was growing up, we had the movies of the week. It was before cable, before VHS, you watch for that ABC movie of the week. Munchausen by proxy was one I remember watching with my, I had a twin sister when my twin sister were like 8 years old. And I don't know who was in it. I really don't know who was in it. But this mom was just horrible to her kid and kept, making the kid sick and taking the kid to the hospital. And finally, they got admitted somewhere, some brilliant doc, probably played by James Brolin or something. He put a hidden camera in the patient's room and actually saw the mom taking poop and then putting it around the IV site to cause an illness in the kid. I just thought that was so brilliant. In a totally despicable kind of way, but just brilliant that the doctor did that. Does anybody even know who James Brolin is? You can Google him. All right. Rare, no typical presentation. The most commonly described symptoms include apnea, seizures, factitious fevers, feeding and GI problems, failure to thrive, behavioral problems, bleeding, and sepsis. Okay? This is different. It's like the opposite of the mom who says, oh, I didn't give him any Tylenol this morning because I wanted you to see that he had a fever. I'm like, don't do that. Give your kid Tylenol if he needs Tylenol. I believe you. I trust you. I believe you. And then you also, in the back of your mind, it's like, and then the mom comes in and says, yeah, his fever was 106.8 this morning, I swear. And stuff like that. Do you know what I mean? I don't know. Presenting symptoms may present along a spectrum of severity from mild to fatal. Most victims are less than 4 years of age. Why? Anybody guess why?
They
Can't talk.
That's right. They're not capable of telling them, the doctor or the provider, the healthcare provider, that, yeah, mom, yeah, something's wrong. All right. But victims are sometimes older children who think this is natural. This is how mom shows love. She smears poop on me and then takes me to the doctor. Males and females are equally represented because there's no prevalence in this patient, it's the mom. Symptoms may be present for years before the factitious illness is considered and diagnosed. Morbidity is significant. Cases may be fatal, especially those involving surreptitious administration of medications, poisoning, or inducing apnea. All right, so think about Munchausen by proxy when you see symptoms and signs described that are incongruent, they're not consistent with the patient's appearance, and are only seen when the caregiver is present. Okay? Diagnostic tests fail to confirm the diagnosis. Usual medical treatment is ineffective in alleviating the presenting symptoms. Caregiver seems unusually knowledgeable or aggressive in suggesting particular medical interventions. Some red flags of Munchausen by proxy. Frequent moves. They don't stay consistent with the healthcare system. They move around. Siblings who have either died or had unusual medical illnesses. Seeking care at a variety of facilities, or reluctance to accept less severe diagnoses. That's a big one there. Talk to me a little bit about siblings who have either died or had unusual medical illnesses. What's one thing you're going to think about when you see that? Do we have some kind of undiagnosed underlying autosomal recessive congenital disorder? So don't forget that, okay? All right. Diagnostic procedures, workup is dictated by the presenting complaint, and EEG for seizures, cardiac monitors for syncopal events. When workup is consistently normal and symptoms are still described, the differential diagnosis should include factitious disorders. If bleeding is the major presentation, identify the blood as the patient's as opposed to that of a perpetrator or even an animal. Toxicology screen may be helpful for unusual presentations of poisoning. Repeated blood or urine cultures with multiple organisms often suggest contamination, intentional contamination of the specimen or of the patient. Special care must be taken to prevent the caregiver from tampering with diagnostic testing. That was the hidden camera in James Brolin's movie. If separating the perpetrator from the patient results in disappearance of symptoms, this test may suggest a diagnosis. Covert video monitoring of a patient's room may demonstrate the perpetrator harming the child. Definitely the James Brolin technique. All right. Effective care requires that medical providers work closely with other professionals in the community, both to gather information and to ensure that the patient's ensure the patient's eventual safety. Child Protective Services, mental health services, and law enforcement, agencies each have a role to play in this situation. Evaluations must be multidisciplinary. A variety of interventions may be appropriate depending on the severity of the presentation, from counseling to foster care to criminal prosecution. All right, that is it for this lecture today. Does anybody have any questions? Yes?
I was curious for the red flags for the Munchausen syndrome. All of those fit like my sister's friend who, and I think it actually hurt because the doctor assumed something was like going on or she was
Something
overreacting.
fishy.
So like,
Munchausen?
well, not necessarily Munchausen, like he didn't believe her. Like whenever she said something's wrong with her kid, she had a 6-year-old boy who died of a heart attack. He had an undiagnosed congenital heart defect. And then her little daughter was like 4 and she had really bad back pains, and she was like, I'm telling you something's wrong with her. And like it went on for like a couple of, like almost 2 years. The daughter ended up having neuroblastoma and she died because they didn't believe her about her daughter's symptoms. They thought she was being paranoid because she'd already had a kid die.
So, what's your take on
Just, I mean, like, keep an eye out for it, but don't disregard parents.
I don't think, in my personal experience, nobody knows that child better than mom. Okay, if mom comes in and says something is wrong with this kid, even if they can't be very specific, that you gotta work them up. I mean, what's the least invasive, most cost-efficient thing you can do to work up a kid in any kind of situation? Huh?
Blood work?
Ultrasound. That kid should have had an echo. An echo would have picked up that congenital issue.
Yeah, but the other one, like, she had back pain. She was a 4-year-old who had such bad back pain that she wouldn't get up and play. And the doctor was like, oh, it's growing pains. It's like,
No,
back pain in a 4-year-old.
no.
So I just know that she was, like, I think they like sued the doctor basically because he missed it.
Did they stay with the same physician after they lost the first kid?
I think so. Yeah.
Wow. That's really sad. I'm so sorry to hear that story. But let that be a lesson to everybody. Nobody knows the kid like mom does. If mama thinks something's wrong, that kid is worth looking into and working up. If you're in a general peds situation, you work the kid up, you can't find anything, and they still insist something's wrong, for God's sakes, refer them to a specialist, There might be something that you're missing. We're not the end-all, be-all, for real.
That's what she ended up doing because the doctor wouldn't, like, he was like, there's nothing wrong with her. So she went to an orthopedic surgeon on her own and he found it and it was fine. But I think it was a metastasis.
That just upsets me so bad. All right, anybody else have any fabulous